I'm Brandie. I'm going to be examining you today.
All right.
And the shades are closed for your privacy.
Perfect.
Can you just state your name and date of birth for me?
Olivia Pingaldi, 13094.
Okay, thanks. And do you mind if I take some notes?
No, that's fine.
Okay, thanks. So Olivia is a 21-year-old female, and she appears to be her stated age. I'm just going to assess your level of consciousness, okay? So can you tell me today's date?
November 22nd, 2015.
Okay, and can you tell me where you are today?
Yeah, the exam room.
Okay. And why are you here today?
Just for a routine physical.
Okay. Olivia is alert, awake, and oriented ×3, and she's cooperative and shows no signs of distress. Her skin seems to be pink and normal tone. She shows no signs of cyanosis, and she seems well nourished and well developed. Her posture seems fine. She's sitting comfortably in the chair and erect. I don't see any signs of physical deformities. So I'm going to assess your gait now, okay? So can you just stand up and walk across the room for me and come back and sit down? Okay, so her gait is regular and she doesn't exhibit any involuntary movements. She seems to not have any range of motion difficulties and she moves with ease. Her facial expressions seem normal for the situation, and she maintains eye contact, and she appears comfortable and cooperative. Her speech and articulation seems clear and understandable, which indicates no problems. She speaks fluent English and uses an even tone and pace. She responds appropriately to questions, and she's able to hear all of my questions with no difficulty. She appears clean and well-groomed. Okay, so now we're going to assess your hair, skin, and nails.
Okay.
So can you just hold your hands out for me? And her hands and fingers seem well-formed. She has 10 fingers with nails on each. I don't see any clubbing or deformities. Her nail beds are pink, and I'm going to check her capillary refill, which is less than 3 seconds. Her skin tone is normal for her ethnicity. Her hands were warm, dry, and smooth to the touch. Okay, so I'm just going to check your skin turner, okay? So I'm going to pinch the skin, and it returns to normal. There's no signs of tenting. It all just goes back to normal. The skin is intact. There's no lesions and no skin breakdown on her hands. So now we're going to inspect your head and face. So I'm just going to palpate your scalp, hair, and cranium. Okay, and do you have any tenderness while I'm doing this?
Nope.
Okay, and her hair texture is fine. It's distributed evenly and appropriate for her age. I don't see any flaking or redness in her scalp. Okay, so now I'm going to check cranial nerve number 7. So can you please smile for me and frown? And then how about close your eyes tightly? Good. Now lift your eyebrows and show your teeth. Okay, and then puff your cheeks out, and I'm going to try to push the air out. Okay, so all the air goes out evenly, and all of her face movements were symmetric, and there was nothing involuntary. Okay, now I'm going to palpate your sinuses, okay? Do you feel any tenderness with that?
No.
Okay. Now I'm going to check your eyes. So we're going to check cranial nerve number 2 with the confrontation test. So can you stand up with me? Okay. And then I need you to cover your left eye. Okay. And then I'm going to bring the pen in and just tell me when you see it, okay?
Okay.
Okay, how about this way? cover your right eye. Okay, and then tell me when you see the pen.
Now.
Okay, again.
Now. Now.
Okay. Okay, so Olivia's visual fields are intact, which is determined by the confrontation test. Now I'm going to assess cranial nerves 3, 4, and 6 with the cardinal positions of gaze test. So, just follow my fingers with your eyes and don't move your head, okay?
Alright.
Okay, so all of Olivia's extraocular movements are intact. So now we're going to inspect her external eye. Okay, so Olivia's eyebrows and eyelashes are present and they're intact. Both are symmetrical. And we're just going to inspect her eyes for her conjunctiva. Okay, so the conjunctiva is clear and her sclera looks white with no lesions. Okay, now I'm going to test your eyes for the pupillary light reflex, okay? Okay, her pupils are equally rounded and reactive to light and accommodation, so that's good. And we're going to inspect her ears. So I don't see any masses or lesions. There's no deformities, no discharge. And do you feel any tenderness when I do this?
No.
Okay. Okay, so now I'm going to assess cranial nerve number 8 by performing a voice test. Okay, so I'm going to cover Olivia's ears and I'm going to whisper a word and she has to repeat the word that I said.
Dog.
Okay, good.
Cat.
Okay, so Olivia's hearing seems to be intact. Okay, so Olivia's hearing is intact and she repeated the words that I stated. So that's good. Okay, so now I'm going to check Olivia's nose. So everything's symmetrical, everything looks intact. There's no deformities that I can see. So we're just going to check the patency of her nostrils. So I'm going to push on one and breathe in for me. Okay, and then the other one. Good. So there's no obstructions that I can tell. Her nerves seem patent. Okay, so now I'm going to check Olivia's nose and throat. I'm going to put gloves on first. Okay, so her lips look pink and intact. No obvious deformities to me. Now I'm going to check your mucosa, okay? So open your mouth. Okay, so her mucosa looks pink and moist. Everything looks fine to me. Now touch your tongue to the roof of your mouth. Okay, good. Now open up. I'm going to check your hard and soft palate. Okay, so that looks good to me. Everything's intact. Now I'm going to check your tonsils, okay?
Okay.
So open up. And her tonsils are visible. They look normal color, no redness or swelling. Okay, we're going to test cranial nerve number 9 now. So I need you to open your mouth and say ah for me. One more time. So the uvula rises in the midline, which means that cranial nerve number 9 is intact. And now we're going to assess cranial nerve number 10 by testing your gag reflex. Okay, so you can sit down for me.
Okay.
And then we're going to test your tongue, your gag reflex by sticking this into the back of your mouth, okay? Okay, so Olivia gagged. Okay, so now we're going to test cranial nerve number 12. So I need you to stick your tongue out for me. Okay, and move it to the left, and then move it to the right. Okay, good. So the tongue returns to the midline, so cranial nerve number 12 is intact. Okay, so now I'm gonna assess Olivia's neck. So everything looks symmetric to me. I don't see any masses or bulges. So the skin on her neck is pink, it's warm and dry. So everything is normal with that. And then I'm gonna palpate your cervical lymph nodes, okay? So do you feel any pain with that?
No.
No? Okay. The lymph nodes seem symmetrical to me. There's no pain, which is good. And then we're going to take her carotid pulse. Okay, so the carotid pulses seem equal to me. Both, I would say, are +2 rating. Now I'm going to listen for any occlusions in her carotid arteries. And for this, I would use the bell of my stethoscope. So I don't hear any bruits in her neck, so that's a good sign. That means there's no occlusions. The trachea, her trachea is in the midline of her neck. Okay, so now we're gonna assess for jugular vein distension. So can you sit back for me? Good. And normally we would put the head of the bed up to 30 degrees. So turn your head to the left. And I don't see any distension on that side. Now turn your head to the right. Good. And no distension there either. Now we're going to test cranial nerve number 11. So I need you to put your chin to your chest. Good. Now turn your head to the left. Turn it to the right. Good. And then can you shrug your shoulders up and down for me? Good. So cranial nerve number 11 seems to be intact. Okay, so Olivia's neck seems normal to me, and she has all range of motion. Now we're going to test her upper extremities. So I'm just going to inspect your arms. Good. This one. Good. The skin seems to be normal color. It's warm, intact. There's no lesions on her arms. Her hair seems evenly distributed on her arms. Now I'm going to test your strength and your range of motion, okay? So bend your arm, and I'm going to pull it. Okay, good. Now, okay, good. Okay, so now try to push my hands outwards. Good. Now can you push them in? Good. Okay, so Olivia has full range of motion with no weakness. And now we're going to palpate her brachial and radial pulses. Okay, so her brachial pulse. Okay, so that one is about a +2. And so is this one, so they're equal bilaterally. And the radial pulse. Okay, that also is a +2 and equal on both sides. Okay, so now I'm gonna assess Olivia's lungs and chest, the posterior and anterior side. Normally this would be done on bare skin. Okay, so by looking at Olivia here, I can tell that her anterior posterior diameter is less than her transverse diameter, which means there's no barrel chest or any of that present. And her chest is symmetrical. So now I'm going to test her chest expansion. So I'm going to hold my fingers in the back and take a deep breath for me. Okay. And one more. Okay. So both sides of her chest expand equally. So that's good too. Okay, so now I'm going to palpate Olivia's posterior and lateral chest. So turn around for me. Good. Okay. Do you have any pain with this?
No.
And on the sides?
No.
Okay, and I don't feel any lumps, and she denies any tenderness, so everything's normal. Now I'm gonna need you to stand. Okay, so let me know if this causes you any pain, okay? No?
No pain.
Okay, so the patient denies any costovertebral angle pain. Okay, so now I'm gonna listen to Olivia's bronchiovesicular and vesicular breath sounds, which is always in the back. Take a deep breath. Okay, her breath sounds are clear. Now I'm going to listen to the bronchial sounds, and this is in the front and on the sides of the trachea. So her breath sounds are clear bilaterally, and no rales or rhonchi are present. Okay, so you can take a seat. Okay, so now I'm going to count Olivia's respirations, and normally you would do this without the patient knowing. So we're going to count for 30 seconds. Okay, so Olivia had 7 respirations in 30 seconds, so you multiply that by 2, giving her 14 per minute. And the skin on her chest is also intact, dry, and warm and normal temperature to the touch. Okay, now I'm gonna palpate Olivia's chest for any lumps, and let me know if you have any tenderness.
Nope.
Okay. Now we're gonna assess the heart. Okay, so I'm gonna inspect Olivia's precordium by placing my 4 fingers gently over the apex of her heart, and there's no visible pulsations, and I don't feel any pulsations, so that's good. Okay, so now I'm gonna take Olivia's apical pulse. Okay, so I got 31 for 30 seconds, so her pulse would be 62 per minute. Now I'm going to listen to the valves in Olivia's heart. So here I'm listening to the right intercostal space for the aortic valve, and now the left intercostal space for the pulmonic valve. Now I'm listening in the left lower sternal border for the tricuspid valve. And now at the mid-clavicular line for the mitral valve. And everything sounds normal. There's no extra sounds or murmurs. And now we're going to check her abdomen. So just lean back for me. So Olivia's abdomen is rounded and everything looks normal. Her skin is intact. It's pink, warm, and dry. And everything looks symmetrical to me. There's no discoloration. I don't see any pulsations around her umbilicus, which is good. And we're going to listen to bowel sounds now. So I'm going to start in the right lower quadrant move around. Okay, so I hear bowel sounds in all four quadrants, which is good. Now we're going to move on to assessing the lower extremities. So I'm going to start by palpating for the femoral pulse. And they're both +2 and equal bilaterally. Now I'm going to feel the inguinal lymph nodes. And the lymph nodes aren't palpable, and she doesn't have any tenderness. So her lower legs are symmetrical, and normally the patient would be wearing a gown with her legs exposed, where you could see if the skin is intact and dry, or if there's any lesions. So I'm just going to check the skin on your legs. Okay, good. And her legs are shaved, so I can't really observe the hair distribution. You take a seat for me. Okay, so I'm going to take her popliteal pulse. And that one's 2+, and then I'm going to palpate the posterior tibial, and that one's 2+ as well, and then we're just going to check the other side. And that's 2+, as well as this one, so both pulses are equal bilaterally. Okay, so put your leg up here, and we're going to assess for any edema. So I'm going to push down, and I don't see any indentation, so that's good. No edema. Other leg. Okay. No edema on this side either. And now I just need you to take your socks off, and I'm going to check your feet. Thanks. I don't see any edema on her feet, and I'm going to check her capillary refill. So the capillary refill is less than 3 on this side. Let's try this one. Okay, less than 3, so that's normal. Okay, so now I'm going to observe your range of motion. So can you bend your knees? Good. Good. And now your ankles. Good. Okay, so now I need you to flex and point your toes, and I need you to push against my hand. Good. Now other side. Good. Good. So Olivia has full range of motion with no limitations. Now we're going to do a neurological exam, and we're going to start by assessing her sensation on her face, arms, hands, legs, and feet. So I need you to close your eyes and tell me when you feel the cotton ball on your face, okay?
No.
Okay. Now we're going to try your hands.
No.
Okay. And feet.
No.
Okay. And then your legs.
No.
Okay. So she's able to feel all the sensations, which is normal. Okay, now I'm going to assess Olivia's Babinski reflex. Okay, so Olivia's toes curl down instead of fanning, so she has a negative Babinski reflex. Now we're just going to do a limited mini mental exam. And in the beginning of the assessment, we assessed the time and place, so she was oriented to that. So now we're just going to finish the mental exam. So I'm going to tell you 3 words. I need you to remember them, okay?
Okay.
Dog, chair, and plant.
Okay.
Okay. Now I'm going to show you 2 objects, and you're going to tell me what they are.
Okay.
Do you know what this is?
A stethoscope.
Good. And do you know what this is?
A pen.
Good. Now, do you remember the 3 words that I asked you to remember?
Dog, chair, prepare and plan.
Good. So Olivia is able to pass the mini mental exam. So that's good. Okay, now we're gonna assess Olivia's musculoskeletal system. So can you walk across the room, heel to toe? Good. So Olivia shows balance by doing this. And yeah. Good. And she has no impairment. Now I need you to bend at your knees. Good. And touch your toes. Good. Now can you lean backwards, forwards, and side to side? Good. So she has full range of motion of her spine. And her gait was, you can just walk back and forth. Her gait is smooth and fluid. She has no weakness and she has full range of motion. So this concludes my assessment. Thanks for your time.
No problem.